The following presentation is an overview of how to use the AirMat system. Please note that this overview is not a complete in-service presentation. Second, note that a patient should be placed on a transfer mat only after an assessment of the patient's condition and mobility. Third, in this overview, we position the AirMat under the patient using a linen changing procedure or log rolling technique. Please note that other techniques may also be used. To begin, verify that the patient's bed or gurney has locked brakes. Then turn the patient to one side toward one of the attendants. Roll one half of the AirMat from head to foot along the patient and tuck it under the patient's back. Then gently turn the patient to the other side. And then unroll the mat and center the patient as you would when changing a bed sheet. After proper placement on the mat, secure the patient's straps loosely in order to allow for the inflation of the transfer mattress. Next, plug in the air supply and then attach the air hose to the bottom of the mat. The hose can be inserted in either side of the mat. Next, move the gurney by the patient as close as possible. Raise the side rail and lock the brakes on the gurney. Verify that the gurney height is about 2 inches below the patient's bed height, and then turn on the air supply and inflate the mat. When the mat is fully inflated and the patient is ready, transfer the patient starting with the upper body and ending with the patient's feet. Then turn off the air supply and remove the air hose from the mat. Finally, if indicated, remove the transfer mattress from under the patient using the same log rolling procedure. Thank you for your attention to this How to Use AirMat overview presentation.